Hi, my name is Dr. Jesse Schulz. I'm a physical therapist in Wisconsin. I'm going to be talking to you today a little bit about neural tension, which is basically an entrapment of the nerve or of the spinal cord somewhere between the beginning of the nerve, which is at the brain, and at the end of the nerve, which could either be in the toes or the fingers or somewhere in between. You can have tingling, numbness, pain, weakness, abnormal sensation, if you have a nerve that's entrapped. And sometimes it's at the site of entrapment, sometimes it's at a site not at the area of entrapment. I've seen people that have had sciatic nerves that are entrapped that actually have only knee pain. Other people that have had tibial nerve entrapment, which can give them ankle pain. Peroneal nerve entrapment, which can kind of reproduce a symptom similar to an ankle sprain. Median nerve entrapment, which can give you neck pain, elbow pain, forearm pain. And basically, this is one of those things that sometimes is missed during treatment. It can be very beneficial. It doesn't always need to be done. And there is some specific testing procedures that I would really encourage to be done before you just kind of willy-nilly take this on for yourself. So I hope with all that said that you've got someone that told you that you have this if you're going to be trying this video to do some self-treatment. But I hope you enjoy this video, and it's going to be talking about neural flossing, which is basically putting slack on one end of the nerve and putting tension on the other to basically get it to move this way, and then putting tension on this side while slacking here to get it to move this way. Basically flossing that nerve through your tissues to kind of try to break it free. After this, I usually recommend some neural tensioning. It's not always needed, but sometimes helpful. Neural tensioning I do not recommend for anybody who's got a fresh injury. Neural tensioning is basically where we try to gently being the key word, pull the nerve from both sides at the same time to basically try to kind of stretch it through tissues that also may be entrapped in. I cannot stress enough that when you do any neural flossing or tensioning exercise, you should not cause yourself any pain. It should be mildly uncomfortable at the very most. And you should always move as fully as you comfortably can. But I hope this video helps you and at the very least is informative. And thank you very much for watching. This video is going to be talking about flossing and tensioning the axillary and suprascapular nerve, but in the reverse order. Suprascapular nerve first. These are two commonly entrapped nerves in people that have shoulder pain, shoulder impingement, and sometimes after surgery as well when strength just is not coming back as fast as it should, or you're just having some weird, goofy shoulder problems. Of course, not every problem that you're having with your shoulder is due to nerve entrapment, especially of the axillary or suprascapular nerve, but definitely sometimes this is something that needs to be considered. Flossing of these nerves many times is quite effective. Sometimes you need to couple it with some median nerve flossing, and sometimes these nerves are just entrapped in the spine, and direct spine treatment needs to be incorporated. But again, this is just a simple how to floss the suprascapular and axillary nerve. So we're going to start off with flossing, basically the nerves in the spinal cord. We're going to be using movements of the neck, the head, the upper back or the thoracic spine, and the lower back and pelvis to basically get the whole spinal cord moving a little bit better. This tends to be, I think, a very good warm-up for the neural system before doing any flossing for the arms or for the legs. So how we're going to start with this is on our hands and knees. If you have any pain in your knees with kneeling, I encourage you to try a pillow underneath your knees that won't take away from the effectiveness of the exercise. If you still are unable to kneel, there are modifications for this, and if you do have a physical therapist that you're working with currently, they'll be able to show you how to modify this. But what we're going to start off with is basically motions of the pelvis at the bottom end of the spinal cord. What we're going to do is let our lower back sag down towards the floor. It's almost like you're sticking out your butt. You're going to hold that for about 2 seconds, and then we're going to basically curl our tailbone underneath us by rounding our lower back up towards the ceiling. And we're going to do this 15 times, holding for 2 seconds at the end of each motion. So sticking our butt out, holding for 2 seconds, arching the back or letting it sag, and then going the other direction. And again, with every motion that we're doing for this, I encourage you to only move as far as you can comfortably, but do move through the largest arc of motion that you can comfortably. After we do 15 each of those motions, sticking the butt out and curling the tailbone underneath us, what we're going to do is raise our back up towards the ceiling, our upper back, like you're kind of rounding your upper back, and then letting it sag down. Holding for 2 seconds again in each position. I encourage you strongly to try to keep your elbows straight if that's comfortable for you. Many times I find that people are bending their elbows and straightening their elbows. They think they're moving their upper back, but they are not actually doing that. So if you keep your elbows locked straight, if it's comfortable for you, it's more of a guarantee that you're doing the right motion with your upper back. After we do 15 of those motions with rounding our back up and letting our upper back sag down, we're going to now incorporate the neck motion. So when I round my back up towards the ceiling, I'm going to bring my chin towards my chest. I will hold that for 2 seconds and let my upper back sag down while I look up as far as I comfortably can with my neck. Hold for 2 seconds and reverse. And I will again do that motion for 15 times. Sometimes you only need to do these motions 10 times or less, but again, if this is the first time that you're doing this, I encourage you to do about 15. That way you know for sure if it's going to work or not for you. Thank you for watching. For the suprascapular neural flossing, I like to kind of have a tongue-in-cheek joke with this, that it's smelling or not smelling the roses. So for the suprascapular neural flossing, we're going to be pulling on the nerve from one end by raising our arm up over our head. And as we're doing that, we're going to be kind of bringing our head towards our arm to provide a little bit of slack from the top. So if you have a shoulder injury, it may be not 100% comfortable to do this. Again, I urge extreme caution with any sort of exercise that you're doing, especially neural tensioning. But if you've already been encouraged that this is something safe for you to do, like I do with my patients sometimes, sometimes you can support your arm with your other one to basically move it for yourself. But if you just have shoulder pain or tingling or numbness, I think that this is safe to do with usually just kind of moving your arm on your own. So what I'm going to be doing, I'm going to be moving my arm last. I'm going to start with bringing my head to the side to provide some slack on the suprascapular nerve from the top. As I'm doing that, I'm going to try to bring my arm behind my head. Hold for 2 seconds, and then I'm going to relax my arm down and tilt my head to the other side. Hold for 2 seconds here. Tilt back this way. Try to put my arm behind my head. Hold for 2 seconds, and then go back the other direction. Hold for 2 seconds there. It's that simple. I usually recommend repeating 15 times. So now we're going to be putting tension on the suprascapular nerve from both sides. We're going to be putting tension on it from the head by bending our head away from the arm that we're going to be treating, and then we're going to be bringing the arm up overhead. So I'll tilt my head to the side, bring my arm up overhead as far as I comfortably can. Being comfortable is always a key for these. Holding for 2 seconds, and then relax down to just a resting position. Again, I'll bring my head to the side. I'll bring my arm up behind my head as far as I comfortably can. After holding for 2 seconds, relax. Repeat 15 times on the problematic side. So, for axillary neural flossing, I like to think of this as doing a one-armed, one-ton lift, which is way too much weight for anybody to lift with one arm. So you're going to imagine that you've got a heavy, heavy, heavy weight in your arm, and as you're holding this heavy weight by your side with your thumb towards your side, it's basically going to be pulling your shoulder down. As it's doing that, your head's going to be tilting this way too. And this way, your neck is providing slack on the axillary nerve as it's coming to my right side right now. And I'm pulling on the axillary nerve from the bottom end by pulling my shoulder down, and by letting my arm come slightly behind my body with my thumb towards my side. Holding here for 2 seconds, and then reversing it. I'm going to pull my head back the other direction as I lift my shoulder up gently, bend my elbow, hold here for 2 seconds. And I'll bend back this way, depress my shoulder, my thumb is towards my thigh, my arm's a little bit behind my body, and my head's tilted to the right. Then again, to reverse it, bend the elbow, shrug the shoulder up, bend the head to the other side. That way we're pulling it from one end, then the other, as far as we can comfortably, doing the one-armed, one-tongue lift. I think the easiest way to think about tensioning the axillary nerve is really to think about lengthening the side of the neck and the shoulder as best you can. Again, only as far as you can comfortably though. So to basically stretch the axillary nerve gently from both sides, we're going to tilt our head away from the side that we're going to be treating, which my side will be the right. As I'm doing this, I'm going to, again, close my hand gently, have my thumb at my thigh or a little bit behind my thigh as I pull that shoulder down, hold here for 2 seconds, and just relax back to the middle. Tilt my head again to the left as I'm pulling my shoulder down, with my thumb towards my thigh, arm a little bit behind my body, hold for 2 seconds, relax. Repeat that for 15 repetitions or 15 times. That nerve, if entrapped, hopefully will move better.